the thing that comes to mind immediately is, again, allowing them to react however they're going to react. There's no wrong way to react to this. And, you know, I think that there's sometimes a tendency, and I'm not sure in regards to what you're talking about in general, though, there's a tendency to want to immediately get on to the, okay, how are we going to solve this? Stay strong. And it implies that sadness isn't strong. And so that's where I get into an issue, because to me there are no emotions that aren't strong. They're all part of our wholeness. And when we don't allow ourselves to have certain emotions, we split off from ourselves and from our wholeness. So I guess the first thing that comes to mind is when you have to break a diagnosis like that to someone, it is to let them have the space to have whatever emotion or emotions, because I would imagine there are several, and they might go very rapid, from one to the next, to allow that to happen, and just to hold a space and a presence to make that okay. To not try to rush past whatever is already there, even if that means just being quiet together for a few minutes. Not having to rush into what's going to happen next or other words, but to really just allow what's there to be there, even in quiet together.
And to refer back to what Dr. Hafron said earlier, a key component is hope. You know, cancer is a terrible word. You're always going to remember when you heard that, but it's our job, given the technology we have, the types of treatments we have, to convey the idea that our outcomes are much better in a way that the quality of life is not compromised like it was prior to coming up with all these new therapies. So hope is an integral component, and you know, you can't offset what that word cancer does to you and your family members, but you got to take that time to understand that and then focus on the main goal of picking the treatment that's going to give you the best chance of the best outcome without compromising your quality of life.
So the other thing is that when you're diagnosed with cancer, it's a very traumatic event for most people. And here at Carmanos, we work together as a team so that everyone that comes through the door takes a new patient, has a distress screening. We want to know, what's your level of distress coming in the door? What's your level of distress after your conversation with your physician, your oncologist? I meet every new patient, especially if they're at a considerable level of distress, so that we can start treating and dealing with that and supporting that right away. There's a grieving period that we go through with a traumatic event, the loss of uncertainty, the loss of control. Even with treatment, there are long-term and short-term side effects that we go through. So there is a grieving process. That's why counseling can be helpful, men's group, mentoring, all of those things can be helpful. So here again, we're an entire team. Several people will be meeting with the person right at the same time, so that you have a chance to get the information, have the hope, but also express your shock or your fear or your concern, or how am I going to tell my children or my grandchildren or my parents. So all of these are issues that need to be addressed, and working together as a team is the best way, I think, to make sure that they are addressed. For the patient, having an advocate. You know, most of you men have somebody, maybe your wife, maybe a good friend, maybe some partner or somebody that's there, because when you hear those words, you're in a state of shock, and you might not hear anything else after that. And so you need somebody else there that can hear all those things and remind you later that this is curable or this is treatable. And because you have to take time, like my colleague said, to deal with all of those emotions before you can move forward. And doing that together with the whole team, I think, is the best approach.